If you're a young dentist today coming out, my recommendation would be, team up with a young MD. I mean, just build a practice that is dental medical based. We know they're connected. Let's just create a niche that nobody else has.
Hey everyone, welcome back to another episode of Gloves Off. My name is David Rice. I'm your chief editor here at Dentistry IQ, and I am really excited to be with.
Lewis Kaufman,
How are you?
I'm doing well. Thank you very much. It's a good day.
It's a great day, isn't it?
Yeah.
And I love we've got like a trifecta going on. So this is our first episode, friends, if you're tuning in, but we're gonna kind of say if I only knew then what I know now, young dentist, these things would have made us really successful. So that's our theme for these three episodes. And Lewis, like if we can start with something I know that's really important to you and you found great success with is this whole concept of um, you know, oral cavity, oral systemic health, mouth health, body health. If you're a young dentist today, what do I have to know and do?
If you're a young dentist today coming out, my recommendation would be, team up with a young MD. I mean, just build a practice that is dental medical based. We know they're connected. Let's just create a niche that nobody else has because you truly can then treat the whole person. You know, uh, I was telling you, David, that I just picked up a book by Lynn Carlisle that was recommended to me. And this book was written 30 years ago or more. And it's the same conversation. We know periodontal disease leads to all these systemic diseases. Well, why aren't we educating our patients more? But nevertheless, why aren't we educating our teams more of why we're recommending this treatment? And, when I introduce, say, soft tissue management into the practice, a light went off in terms of assistance and hygiene, as it wasn't just a sales tool. No, we can really help people. We can impact patients' lives.
I love that. I love that. So how how do you connect with maybe the right MDs? Like, do you have do you plan around that? Do you think about that? Are you targeting, one or two MDs? How do you look at that aspect?
So if I was again, and I'm not doing this right now because that's not my style of practice, having
Yeah.
an MD. But if I was just getting out in today's world, and we know that this is such a big issue, I would connect with young MDs as maybe go to the medical school, see who's graduating, see who's starting residencies or fellowships, see if you can associate with a hospital in your area, get rights to practice there. I think that's how you meet the young doctors, and maybe put an ad out in a paper. If they have papers now, online media, they don't have newspapers. They don't know who reads the newspaper anymore. I mean, I do, uh, but but still, with social media, there's got to be in that realm, just like we have in dental, in the medical realm, there has to be that same funnel, if you will, that same connection out there, because we know it's a fact.
Yeah, I like that, and I think you're right. I think on social media, young docs are watching here, or seasoned pros if you're still young at heart, love you even better. Just being on Instagram is one example. You see the people who sort of resonate with you, and they're talking about the same things on the other side of that aisle, which is medical, and it's so easy just to DM those folks and build a relationship over time and make that connection and make it happen. So you see that as a way to like really separate yourself and
Yeah,
dentistry moving forward and helping. I like that. Why do you think that's like so important today?
because somebody's got to make a change. Somebody's got to do it. Somebody's got to set it up for success. We see the innovators and thinkers out there. You see it on social media about, wanting to set up a dental hospital. There's a reason why they're thinking that way, because we know there is a direct impact, to how we're treating our diet, what we're consuming, to our overall health. But then again, we got periodontal disease going rampant, and caries is the number one disease still in this country today. We need to change it. And the only way to change it is to, one, uh, have the conversations with these patients that we're seeing more often in our practice. If we have an MD that's close by, maybe in the same office, like I'm saying, in the same, or same suites, then there's cross referrals, cross pollination is occurring. That's a unique uh, selling option,
Yeah, I agree.
or what do they call it? Product. Not that we're a product, but we are a product in essence. When you look at marketing in terms of branding, it's a selling proposition. You're offering something that's unique to the patient that's going to benefit everybody in the long run. And that's what we want. We're all humans. We want these patients to be healthy. We want to keep them healthy.
Yeah. And our patients want to be healthy. They're just not necessarily accustomed to coming to a dental practice and having this conversation with a young doc or a hygienist or an assistant, because it's out of the box. So, all right, young docs, I need you to think differently. It's easy to get lost in all the noise that's out there in dentistry. It's too difficult, quite honestly, to compete and do the same exact thing that every other practice is doing. I know many of you live in big cities and you're looking to the left and the right or upstairs or downstairs in one same building. And there's a lot of us, which isn't a bad thing, but you can think different. You can be different. Get out there, find yourself a great MD who's got vision like you have vision, and truly start walking that oral systemic talk that we've been doing, to your point, 30 years. So thanks for joining us, everybody. Tune in next time. We're going to talk about another new dentist topic. What you're going to want to hear about, it has to do with this whole team turmoil and turnover thing. So see you next time, gang.